I look at museums and see, these iron lungs and think, what did my predecessors know of iron lungs? But they adapted to that care. In my own career, I was working in the emergency room, and we were starting to see infections that burgeoned to HIV and hepatitis beyond hepatitis A and B. And we continually, as professionals in nursing and pharmacy, in occupational health and other disciplines, we continually are preparing a workforce that can manage these new challenges, and also a workforce that has an understanding about the stressors and the need to support each other, and to provide ongoing vigilance to make sure that the people who are caring for people also stay healthy.
Does anybody have a question out there before I ask another one? Anybody would like to ask one?
And Dennis, just so everyone knows, Dennis, while we're speaking as well, I did just throw up in the chat room. If anyone does have a question, please feel free to key it, and then we'll make sure that Dennis sees it.
I have one from Mayor Sherry Cantor, who could not make it tonight, the mayor of West Hartford. Her question is, what different skills and resources will healthcare workers need to care for patients with the so-called long COVID? Who wants to take that?
Well, I think what's going to be really important for those people that are experiencing symptoms for a long period of time is around their strength and conditioning. So we're going to be looking for professionals like occupational therapists and physical therapists that can help with strength and conditioning, energy saving techniques, learning, helping to teach those folks about how to adapt their environment to be able to do those everyday activities that they'd like to get back to. And we don't know what the long-term health effects will be with COVID. I was thinking, Maria mentioned polio, and we saw in the 1980s post-polio syndrome. We don't know what the long-term health effects of COVID will be. And so it'll be really, we'll need our nurse practitioners, our physician assistants, our doctors to really be vigilant at helping people navigate what those long-term symptoms are. Maria, do you want to add anything to that?
No, I think you covered it well. We especially are not sure how this is going to evolve. We've already heard that people may have some neurological effects that they're seeing, muscles deteriorating. There's some evidence that the heart muscle itself can be impacted. And even the strongest, fittest people who recover, they often talk about a long period before they regain their energy.
I have a quick question, because we've all seen that the numbers of COVID-19 positive tests in our state have skyrocketed. And a few weeks ago, I downloaded that new app that you have on your phone. So it pings if, or it sends you an alert if you're near someone who has COVID. But I haven't had a single ping or single alert at all since it happened. Has anyone downloaded that? Has anyone had a response at all to it? No one.
I guess great. It means everybody's social distancing and doing the things.
which is good to hear. But the numbers, the numbers released by the governor's office today certainly were much higher, and I know that it is a point of concern for so many people, because earlier in the year, Connecticut was praised for the way that we had such low numbers and the way that we were practicing social distancing. And I have noticed when I went to other states, it's not as they don't follow it as closely as we do here. So in that regard, I often feel safer in our state than other ones. But let's talk a little bit about the vaccine. Who wants to update us on sort of the situation with the new vaccines that are coming out? Anybody? We have an expert who wants to talk about it. I can look up information if I have to, but.
Well, I'm certainly not an expert on it, because I'm an economist and I have no background in healthcare at all. But one of the things that we've been faced with for the last 9 months is that students who are preparing to go into these healthcare fields have a strong commitment to their dream job. And so when we at times had said to students, maybe you should not be participating in your clinical rotation, we got tremendous resistance from students. They want to be there. They are preparing for what they view as a lifetime, as being a nurse or a pharmacist. You know, Maria is the type of person that they really aspire to be with. So one of the things in terms of the vaccine that's been important for us, and this information changes for us day to day, is whether nursing students will be in the first round of people who can get the vaccine. And so my understanding as of today is that they will be. And for our students, that's really important, because so far they really, this semester, have not had to miss any time in their clinical rotations. They've been out there in the hospitals, the research labs, and so on, all semester. But there is concern that as we go into January and there may be more COVID, that hospitals would not be able to let nursing students participate in their clinicals. And so Maria would know more about this. But so far, the news looks really good from our students' perspective, which is that they probably will be in the first round. So they can keep making progress, they can keep supporting people like Maria in the hospitals and moving toward their degree completion.
Maria, what is Hartford Healthcare saying about the vaccines that are coming out, or the vaccine?
Well, not being the expert on it, our pharmacists are, we've made some preparations in terms of the storage that's coming and how much will be allocated to the hospital, so that, you know, that it's very hopeful that the vaccines are coming, and we're anticipating them with, you know, great hope about it. But in the meantime, we still have to get through the next couple of months. So that's really our focus, because some of these vaccines require a dose on day 1, a dose on day 21, and then 7 or 8 days until immunity is affected. So that's, you know, a month. And while we certainly want to work towards that and support it in various ways, that the organization, Hartford Healthcare in general, is looking at coordinating and supporting the community and getting vaccines, are immediate. It's not a quick fix for the next few months, where we can't let our guard down, and which are going to be very challenging the next couple weeks.
Let me ask out there, and just a quick raise of hands, how many people want to get that vaccine right away, would take the vaccine? We got a few out there who will take it right away. How many are a little concerned and they want to wait and see what happens? Okay, we got a few out there. Yeah, I think a lot of people are apprehensive, as we were reporting earlier this week or last week. They've reached out to former presidents Barack Obama, George Bush, and Bill Clinton to be the first ones to publicly get this vaccine out there, so that people will see prominent people getting it. And Maria, or whoever would like to answer this, do you think that that will help sway public opinion?
I would hope so. I think that there's lots of apprehension about taking anything new, but once we start to see people we know, big, you know, famous figures like the former presidents taking the vaccine, I think that will help. I think we'll have to do a lot of public education about the safety and efficacy of the vaccine, and dispel some of the myths that are out there.
Great. Dennis, I see that some people have submitted some questions in the chat room, so I'd like to start with that. Bernard asked, are there lessons learned in how biotech firms approach development of vaccines that may be applicable to other illnesses, and how is the subject taught? Who would like to weigh in?
Go ahead, President Free.
I'll let Betsy can answer with more detail. But today I was working on I have to make a welcome comment tomorrow night to an event that is replacing our campus festival of lights, and which was our traditional sort of Christmas festival. And so instead we're having a night of unity, where we're talking about unity. And it occurred to me that there cannot be many times before in history where everyone around the world was interested in the same topic and would be thrilled with the same scientific accomplishment. And so I think one of the lessons about what happened with the development of the vaccine is that government support for research in science and healthcare is absolutely critical. If it wasn't for the government support, I don't think this could have gone as quickly as it did. The vaccines would not have been developed as quickly as they have been developed. So whether it was government support in the US or other countries, I think one of the big lessons is that there is a critical need around the world all the time for support for science, for research in health fields.
Hillary, next question.
Great. Yeah, the next question is from Kylie. Thanks, Kylie. How do you see the role of non-clinical healthcare workers changing?
Well, that is a great question, because when I go to work, I think of Hartford Hospital almost like a city. There are so many needs that are non-clinical roles that need to support, that city or that workplace. And there's 7,000 people who work at Hartford Hospital, and we care for 650 inpatients a day. So we need a lot of skills. We need people who are experts in biomedical engineering to keep a lot of our technology going. We need people who are experts in radiation safety, industrial hygiene. We need engineers, architects to help maintain our facility and plan for the next unit that has to be built or adapted. We need chemical experts, toxicologists, schedulers, statisticians, researchers. As I said, it's really a city where there are many opportunities beyond direct patient care to support our mission.
Great. We do have another question. If people are transitioning careers, is it helpful to have a certificate in a specialized area if they don't have time for a 2-year degree?
I think any type of specialty certificate, it allows you to get your foot in the door, and to then think about what area of practice or what clinical area, what healthcare profession may be of interest to you, to then go on for your 2-year or your 4-year degree. So any kind of a certificate is a way of getting your foot in the door and opening up those opportunities and learning about the variety of healthcare professions that are out there. We've talked a lot about nursing and medicine, physician assistants, and Maria talked about all the other different types of opportunities there are at a large hospital like Hartford Healthcare. And I'm thinking about other professions in human services like social work and counseling, public health. So there's lots of opportunities out there. So dip your feet in the water and any kind of way of doing that, I think, is a great start.
Great. Okay, thank you. We have another question from the audience. Joy is asking, hi Joy, I'm networked with many healthcare practitioners and so-called alternative healthcare practices, including chiropractors, health coaches, essential oil coaches, nutrition coaches. Are you seeing an uptick in those areas?
I think there's always been an interest in traditional medicine and non-traditional or more Eastern medicines. So we offer here at the University of St. Joseph, all of our programs are accredited by external accrediting bodies that have rigorous standards of practice. So in addition, sometimes our health professionals will look into things like those alternative medicines as a way of augmenting their healing. But the programs we offer here are really traditional accredited programs. Nutrition, dietetics, nursing, certainly we have a long history of nursing, physician assistants, pharmacy. So those are, but I think that we have to follow the research. We have to follow the science on what supports the use of those alternative medicines.
Great. Okay. We do have another question. Let's see. With more healthcare epidemics, is there a pathway for high school students who want to go to college but aren't sure what to major in for public healthcare in general?
We offer here at the University of St. Joseph, we have a couple of majors that might be really of interest. We do have an undergraduate program in public health, and we have a graduate, our MPH program is a totally online program. We also offer a degree in health science that is more of a general degree that allows people to explore a variety of health careers, as well as a great pathway to graduate programs in occupational therapy, physical therapy, physician assistants. So I would suggest exploring either public health or health science. And we'd be glad for you to apply to our programs.
President Free and Betsy, a question for you. And earlier in the program, I believe it was you, President Free, who mentioned that some people are seeking second careers in the healthcare industry. And I'm wondering, and without giving away people's ages, like how old are some of these people getting into this field? I'm just curious.
Yeah, so we have a number of ways that we see adults enter these fields. One of them, for example, is what we call an accelerated second degree program, where someone who has a bachelor's degree comes to the conclusion that they would really like to get trained as a nurse. And so they have a calendar year that it's a tough calendar year, but a calendar year where they complete all the requirements to take a licensure exam. And we see those students come in, they come in May, typically. And we see people who are easily into their 50s, making a decision that this is a good investment. Now it's what they wanted to do all their life. They may not, sometimes we may look at it and think, well, will this person really financially, will it pay off? But for some of those people, that's not the issue. The issue is this is what they've always wanted to do. And then I think one of the other things to mention is that there are numerous sources of grant funding and financial support for traditional age college students and non-traditional age students who want to go into any of these fields. And so, at the University of St. Joseph, we have lots of financial aid programs, but there are also aid programs from the state. There's the Roberta Willis support program for students. There are lots of grant programs that make it so that for most students, it's a good investment to go back, whether to get trained as a nurse, a nutritionist. We have an exercise science program, the health science program. So there are lots of ways to get financial support for it. So it's got a good return on the investment. But even beyond that, for people, it's a way to live out what they had always dreamed of doing.
When you finish training to be a nurse and you get your certificate and your degree, what is the job market like out there right now? Do you have several offers to choose from? Does it involve relocating? I'm just curious how hot of an industry it is right now.
Yeah, so I'll just give a little bit of data and then Betsy and Maria can chime in. So one of the reasons that there's such a shortage of healthcare workers now is that our population is aging, and people who are older use 2 or 3 times more healthcare services than people who are younger. They're more likely to have chronic disease. But also a big portion of those retiring workers are healthcare workers. And so over 1 million nurses are currently over the age of 50 and will retire in the next 10 or 15 years. So there's going to be a huge demand for nurses in the next 10 or 15 years, in large part for that reason. So Maria and Betsy can certainly comment more on that.
Sure, I think it's probably one of the mainstays of a career in nursing or related health fields that the employment throughout your career is pretty secure, and it's a very portable credential to move about the country or the world. And there are many venues for it. You know, we've talked a lot about, you know, working in the hospital, but public health, visiting the care for patients at home and visiting nurse venues, occupational therapists going to the home, physical therapists in the community, nurses in the schools are very important for our community's health. So the job market across the board for people with solid educations in health field is very promising.
You know, we've had a long history of offering really quality academic programs here at the University of St. Joseph, and our graduates are highly sought after. They often, to answer your question, Dennis, have multiple job offers before they even graduate. So it's always exciting to see where they go and where they land. And we have lots of opportunities right here in Connecticut. They stay close to, our students stay close to home.
Does it pay fairly well for a brand new nurse when you're first starting out, or is it like most industries where you have to start off at a lower wage and really work your way up?
I think it pays well. I think it's a very competitive when you compare it to other majors.
So
Yeah,
it's a good field to go in.
I can give you some facts and figures about the starting salaries for many of these, like physician assistants start at 125,000, OTs start at 85, PTs start at 90,000. Dietetics, nutrition starts in the mid 60s. Those are nice starting salaries for graduates.
How many students do we have with us here today? Because I see a lot of young people here. Just raise your hand if you're a student. We have some students here. All right. And keep it up if you're going to the healthcare field. Excellent. That's great. That's encouraging news. You know, Betsy, that's good to know that they'll have multiple job offers and they'll be able to. There's so many industries out there where it's tough to get a job when you first graduate from college. So that's really encouraging. And it's the same here in Connecticut as well. You know, sometimes we kind of buck the trend sometimes in job things, but that's good to know that that's not the case.
Yeah, it's interesting if you looking at the market for healthcare professionals in Connecticut. This is one of the tightest markets, partly because students who get their degrees from colleges and universities in the state of Connecticut. I mean, one thing is that in Connecticut, there are very tight accreditation standards. The Office of Higher Education monitors things closely. The universities that are offering these degrees are accredited by really tight standards. So there is a limited number of students who are graduating from these programs every year. But the students who are graduating not only have this market in Connecticut, but they're often pulled to New York City or to Boston or to Providence. And so there is a challenge with keeping enough of these graduates in Connecticut because they can so easily move to these surrounding cities and states.
Do we have any of the students who want to ask a question? Because I am a professor now, I can call on you. Somebody,
Dennis, while they're thinking of that, I'd love to just add that the chat room has been lighting up from the admissions department at University of St. Joe's, and they've just said that they welcome anyone to call or to email them with, they'd be happy to discuss what different options they might have with different majors, you know, and different options and different programs. So if we all remember that as well you just had an open invitation from University of St. Joe's admissions to give them a shout out.
That's good to know. Great to know. Yes, absolutely. Right. Yeah, Betsy and Dr. Free, and as this pandemic advances and changes and we learn new things about it, the professors at USJ, how quickly do they have to change their curriculum and teach about COVID?
So I'll let Betsy answer that.
Faculty constantly have to keep updated. And what's really wonderful about a lot of our faculty is we have faculty that are actively in clinical practice, and we have faculty that are active researchers. So there's faculty have to, by their own licensing, keep updated, keep abreast of the changes And in the medical world, that's a constant change, not just with this pandemic, but that's a constant change.
Yeah, so I think, one of the things that for example, nursing faculty do is not just have to keep up with advancements in the care in this country, but our nursing faculty every year go to sites in less developed countries or developing nations. So, and they take students with them so that they can see what it's like to provide medical care when you're working with equipment that may be very out of date, when you don't have all of the supplies that you need, when you're in an environment where, in this country, where a nurse would dispose of something as soon as it was used, what it's like to work in a country where they think that's wasteful, and so they have to reuse things. So it's not just keeping up with medical advances in this country. So we try to prepare students for what it's like providing medical care in other parts of the world in very, very different conditions.
Hillary, do you have any other questions coming in from the audience?
I actually have a question. In continuing that thought about the universities and keeping up with current events and what's going on, what do you see as universities' roles and possibly University of St. Joseph's role, perhaps in the distribution process of the vaccine? Do you know if that will come into play at all, universities' roles?
Yeah, it will. We have had communication between our pharmacy program and the distributors of the vaccine, so that our pharmacy program is a 3-year accelerated program. Students start once they have a bachelor's degree. Their first year, we call them P1s, and their second year, they're P2s, and their third year, they're P3s. P2s and P3s have completed all of the training necessary to administer vaccines. And so we are now in the process of communication with the distributors so that those students will be supporting that, the vaccination effort. Certainly something very critical that we feel is very critical, partly because we know how important it is to get our students vaccinated as quickly as possible.
I have a question for Tom Hickey. Since you're our media expert tonight, I'm going to call on you. How important will the role of the media be as we get information out about the vaccine? In terms of, we hear millennials don't read newspapers and they don't necessarily watch the news on television. They get a lot of their news from Twitter and Instagram and things like that. So how important will those venues be to get the message out?
I'd like to say that the traditional will be very important, and I believe that it will be, but the most important, I believe, will be social media. It'll be what we're doing this evening, and having symposiums and series of this nature. I just received a text from the managing editor at weha.com. So thank you for the segue, Dennis. And Ronnie Newton told me that tomorrow night on Facebook, there's going to be a Hartford Healthcare vaccine specialist on weha.com's Facebook Live starting at 7 o'clock. So I didn't know that 3 hours ago because it probably just happened. So I think it's going to be instrumental and key in having people feel comfortable and getting out there and participating and getting vaccinated.
Yeah, because we all have so many questions about this vaccine. And Maria, I want to ask you, and maybe it hasn't been determined yet, but will all healthcare workers at Hartford Hospital be required to get the vaccine?
At this point, it's not a requirement.
Okay.
Flu vaccine is required unless there's a compelling health issue not to. But at this point, for the COVID vaccine, it is not required. But that could change.
Okay. Would that mean if someone didn't want to take it, would they perhaps be reassigned to another part of the hospital? Is that still being determined?
Yeah, I think I don't know enough about that. I think right now there's strong support for people who are working who want it. I think the majority of people will be very amenable to getting the vaccine.
Okay. Betsy, perhaps you can tell us a little bit about what kind of, for lack of a better word, on-scene training these students get in terms of actually going into hospitals and nursing homes and things like that. When does that happen? Is it sophomore, junior year and things like that?
Absolutely. So we start for our nursing students, we start in our sophomore year. Every year they have different clinical rotations. All of our healthcare professions and human service professions do hands-on training, whether it's clinical training, field training, can be in the hospitals. It can be in more community agencies like with Hands on Hartford. Our nursing students, our nutrition students go out and get experience at something called the Multivan, which is a mobile healthcare unit throughout Hartford. So we have a variety of different types of opportunities for students, requirements. All of these are a certain number of field requirements. We also, and we're really excited about this, is we are expanding our simulation and skills lab, and we'll be doubling our space, which will allow students to work with mannequins, high fidelity mannequins, to practice their skills and gain confidence in their skills and competence in their skills as well. So we're really excited about that. Our nursing students will be using that, our physician assistants, and some of our other healthcare professions will be using that skills lab together. And that'll just provide some wonderful hands-on training for them. We've also, Hartford Healthcare has been so generous. Many of our students go to Hartford Healthcare. I think because of the reputation of our programs, they've really, throughout this pandemic, kept open arms for our students to be involved in doing their clinical training and to keep on track to graduate.
Excellent.
Actually,
Oh, sorry, Rona, go ahead.
well, I was going to say, the point that Betsy raised goes back to something that Dennis asked about earlier on, which is how has the training of nurses and other healthcare professionals changed because of COVID? And one of the really important things that the University of St. Joseph has to do, and other colleges and universities, is make sure that all of our programs are complying with these really strict accreditation and licensing requirements from the accrediting agencies in each discipline. And that's wonderful that there are these really tight standards, because it really is quality control. It ensures that students don't progress through the programs unless they are meeting competency expectations. It ensures that when they graduate, Hartford Healthcare and other providers of healthcare are confident in their skills. But it has curtailed to some extent our ability to graduate students, because students have had to complete a certain number of hours of clinical experience, and hospitals just can't provide all that many. But because of COVID, one of the adjustments that we're seeing the accrediting agencies make is that some clinical hours in a hospital can now be replaced with hours in a simulation lab. And that's because the simulation equipment, these mannequins that Betsy talked about, are so incredibly sophisticated that they provide a good, it's not a perfect alternative to being in a clinical setting, but it's really good. And so the accrediting agencies are allowing some of those clinical hours, because of COVID, to be replaced with simulation lab hours. And that's partly why we are expanding our simulation lab, is because it will allow us to prepare more students in compliance with these accreditation standards. So I think that's one of the really key responses that we've seen to COVID.
Speaking of students, I want to call on a couple just because I'm curious what they're interested in doing with their career. So I'll call on Olivia and Samuel, and maybe you can just unmute yourself for a quick second if we can. And I'm just curious what you're going to be, what your career goal is. Olivia?
Well, I want to become a forensic nurse.
Right.
Forensic nurse. Excellent. How about you, Samuel? Nobody can hear me. Okay. Do we have another student who wants to just throw out what they want to do?
Just
No.
unmute yourself.
Yeah. Samuel, unmute yourself and you can just tell us what you want to do.
I am a junior in high school, and I would like to be a pharmacist.
A pharmacist and a forensic scientist. I mean, a forensic nurse, that's awesome. So just for those of us who don't know exactly what a forensic nurse does, what does a forensic nurse do?
It's kind of between like the healthcare and the law combined together. Because I'm also interested in like the criminal justice, so it's something that combines both interests for me.
Okay,
Wow.
excellent, excellent.
Fantastic. I have a question, if I can jump in. Issues like community service and maybe social justice are important to the younger generation. Do healthcare students have a chance to influence systemic change for our society or give back in any ways?
That's a great question. One of our core values here at the University of St. Joseph is service. And so all of our freshmen, their second semester, their spring semester, take a course, a 1-credit course, where they provide service to the community. So whether you go into healthcare or another field, all of our students have an opportunity to provide service to the community. And I think that's a really important piece. I have great hope for this next generation because they are so service oriented and really believe deeply in social justice issues, which again align with our core values here at St. Joe's.
So one of the nicest things that we've seen with our nursing program is that as for many of them, when they do this 1-credit service opportunity that Betsy just talked about as first-year students, what they do is work at the Sandwich Ministry at St. Patrick's Anthony Church in Hartford. And what they'll do is when individuals come in to get their lunch or their dinner, our students under supervision will take blood pressure and do other very simple measurements. And there are students that even when they no longer have to do it, will continue to go back to the Sandwich Ministry every year and even after they graduate. So we have some alumni who continue to go back and do that as their just a volunteer service, which is just terrific. And I think students who knew each other many years ago meet to do that. So that's one way they can affect society. But I think also in terms of things like Samuel is talking about as a pharmacist, we have pharmacists who are doing research in the development. A lot of our pharmacists, for example, are working on non-opioid pain relievers, on new approaches to managing autism. So there's a lot of different opportunities for students who are interested in social issues to apply their medical expertise, their healthcare knowledge to social justice issues.
We only have a few minutes left, so I want to throw it out there. If anyone had a question that they wanted to ask.
I have another question
Hillary?
that had been previously submitted. What lessons should the Connecticut health industry and healthcare system take from the pandemic, going back to the pandemic?
Well, I think people are going to be studying this for, many, many years to come. But some of the things that come to mind for me is the need to be able to very quickly adapt, to have some stockpiles, if you will, to immediately be able to have things in warehoused so that we don't have to rely on supply chain to immediately in the moment stock things. So we have already made some changes along those lines. And I also think that the role of emergency preparedness is going to take a much higher priority for these massive challenges when something descends upon us like a pandemic. So I think we will see healthcare professionals training more with FEMA, working more to provide a very cohesive response to emergency management at the local level.
Excellent. Hillary, any more?
I think that should do it.
That should do it.
Yeah.
Hey, is there any topic that our panelists would like to address briefly that we did not bring up tonight? I think
one thing that resonates with me throughout my career And I've been at it for 48 years. And people, my family keeps teasing me that I went to school with Florence Nightingale, who, by the way, decreased the mortality rate by from 45% to 2%. But she was a few years ahead of me. But one of the things that in thinking about this evening and talking with colleagues here and students in the community is that for a lot of us in healthcare, it is really beyond a job. It is beyond making a living and really so central to what we do for a living. So I hope that whatever your passion is, whether it's in healthcare or other disciplines or another major at USJ or somewhere else, that, we are so fortunate, the ones for us who've really seen this as a way of really living far beyond a job.
Well, this was a great honor to do this tonight. I want to thank everyone for joining us, and thanks for having me. And I'll throw it back to Tom Hickey.
Great. Thank you very much, Dennis. We couldn't have done it without you. We appreciate your time and all your energy. Thank you to everyone for tuning in. Olivia, just a shout out to you, because our second series is going to focus on not just criminal justice, but forensic and social justice. So I think some topics you'll be interested in listening to in March of 2021, once we get through the holidays. So be watching for that on social media. Thank you to Betsy from University of St. Joseph's, and to Maria from Hartford Healthcare, and of course Rona as University President, for allowing all of us to spend some time with each other this evening. One final shout out, even though I see her name but not her face. None of this would have been possible without this brainchild of Diana Jensen Sousa's coming up, and Diana's the one that worked with all of us to make this happen. So we're delighted to be able to bring this to the community. Stay safe and be well. Thank you for joining us.
Thank you. Good night.
Thanks, everybody.
so
Good
much.
night.